Good evening. A warm welcome to those attending and also to our viewers watching live on the Council YouTube, Hillingdon, London. This is a meeting of the Social Care, Housing and Public Health Policy Overview Committee, and my name is Councillor Palmer and I'm Chairman of this meeting. A key role of this committee is to monitor the performance of local public services within its remit and to hold in-depth reviews on topics of resident interest. We engage with a wide range of external witnesses in our activity, which can include community groups, residents and subject matter experts. Where we identify areas for change or improvement, we make recommendations to the decision-making cabinet. Details of the business to be considered today is shown on the agenda, copies of which are available in the room and also accessible on YouTube underneath the broadcast. For those present in the room and intending to speak, please note that you will be filmed and any statements you make will be recorded and made public. For those in the public gallery, you won't be on camera. A reminder to councillors, officers and those speaking today that you should turn the microphone button on when speaking. This will ensure you can be heard in the room and by those watching online. So first, going around the table tonight, let me introduce the people present. Starting on my right, Councillor Duncan Flynn, Councillor Ian Edwards, Councillor Becky Hagger, Councillor Judith Cooper, Councillor Alan DeVille, Claire Solly, Kate Kelly-Talbot, Zafar Zilkin, Peter Malowich, Tony Zayman, Councillor Janet Gardner, Councillor Tony Edgington and Anisha Teji from Democratic Services. We'll start please with agenda item 1, apologies for absence.
Apologies from Councillor Rodriguez.
Thank you. Agenda item 2, declarations of interest in matters coming before the meeting. Are there any declarations of interest?
No.
That's no. Thank you very much. Agenda item 3, to receive the minutes of the previous meetings. Agenda item, pages 1 to 4 on your agenda. Please indicate if anyone's got any. Yes, Councillor Edgington.
Yes, Chair. On
So what are you suggesting goes on there, Councillor Edgington?
Can you do? Thank you. Yes, what I suggest I would hope could be added would be a question was raised why the safeguarding plan was not on the council agenda, and the response given was that it was about to be dealt with by September 2019. For implementation in September 2019.
Is that what we remember was said? Anybody?
Yes, because I mentioned it was with the cabinet member, but that the arrangements didn't need to be in place until September, so it would still be dealt with through the governance processes in time.
Okay, then that's fair enough. If that's a more accurate observation of what was said, then we will take that on board. Thank you.
Yes.
Is it just you and me? Councillor Edgington, please carry on.
Thank you. Yes. On the part 2 item related to the children's home, I wonder whether I will be careful about what I say.
Could we be careful? Because
because I won't say anything apart from here.
It now.
I will just say that there has been another Ofsted inspection, and I hope that we will discuss that later on in the meeting. Well, it's a matter arising from the minutes.
well, we'll see how we go with that. I can't quite see where that fits into today's agenda, but I may well need a couple of minutes to process that. But I'm going to remind you we do have the corporate parenting panel, and at the moment we are talking about the minutes and the accuracy thereof. Any other observations? Okay, we'll go on to part 4. Everything is in part 1, I believe, today. So we'll go on to agenda item 5, which is the Hillingdon Local Safeguarding Children's Board and the Safeguarding Adults Board report, pages 5 to 70 on your paperwork. I believe we're going to have Claire Solly, who is the Head of Service Safeguarding Adults and Principal Social Worker for Adults, to talk and lead this through, and we've got Kate Kelly-Talbot, the Assistant Director of Adult Social Care. Do you want to talk us through anything you feel we need to know? We have read the report, obviously, but if you want to highlight something, and there may well be some questions, Claire. Thank you.
It's okay, I'm going to lead this part of the discussion, and Claire can come in. Kate,
okay, sorry, I've got that the wrong way round, but thank you, Kate.
It's not my intention to talk you through the report. You will have had an opportunity to read it, and I'm happy to take any questions at the end. There were just a couple of areas I thought it may be helpful to look at in some more detail. So the start of the report is just outlining, obviously, our arrangements and then giving some background information in Hillingdon. You may have noticed in terms of page 15, there has been a marked increase in the number of safeguarding adults concerns and the number of safeguarding adults inquiries. There is some narrative within the report about that. The increase did happen after we'd reviewed some of our working arrangements to make sure that we were fully capturing all safeguarding concerns and looking at how we were working with the police and other partners to make sure that all concerns were being reported and correctly logged and recorded. So whilst that increase so I'd consider the increase to be a positive step, which is about how we've worked better in terms of our recording and referring processes. I think one of the other areas of that may be of interest is around the types of abuse. This has been looked at, and it is broadly in keeping with the picture that we see nationally in terms of types of abuse, so Hillingdon's not particularly an outlier in any way there. The partners have all provided their updates. In terms of safeguarding adults, in terms of adult social care, I think one of the interesting areas of work continues to be the work that we're doing in terms of driving up, improving our providers, and the work of the Council's Quality Assurance team and the care governance arrangements that we have in place. Other partners have provided their updates. I think it's important to recognise that Safeguarding Adults Board is very much linking in with a number of other boards and strategic priorities across the Council. And on page 28 we have the priorities for the Safeguarding Adults Board going forward. These were set in the strategic plan in the spring of last year, and it's a 2-year strategic plan, so we're 1 year into that currently. There are some examples here around safeguarding, but if there's any questions we'd be happy to take them.
Thank you. I mean, it's a really, really comprehensive report, and thank you to everyone that's taken part in that. And I'm personally pleased to see so much in there about how our domestic abuse services have improved, and I hope that that will continue, because we've seen reports before where it hasn't featured as strongly as it does now. So it's because it's part of what I do, and with Councillor Gardner, it's good really to see that embedded in the report. Does anybody have any questions?
Thank you, Chair. Yeah, thanks for the report, really good. I got quite into it, actually. I was like, yeah. One of the things I did pick up was exactly what you said, actually, a minute ago on page 15, and the difference between the reporting, so how we're having the calls come through, and then actually what we're doing. So could you just explain a little bit more? I wasn't too sure whether if people knew what to report. I think that was my first question. So if people knew what came under safeguarding, so whether there was calls coming in that didn't really come under safeguarding, but people were reporting it. And following on from that, once it's reported, how do we deal with that? Thank you.
Yeah, sure.
Thank you. Yes, I mean, the report outlines that there has been a change in the number of concerns that are reported to the local authority, and that's reduced by 2%. So what we mean is there's a number of referrals that come in from professionals, members of the public, residents, and a threshold is applied that's found within our legislation, so the CARE Act. And what we're finding is we're becoming better at applying the statutory threshold for safeguarding, and what that's resulting in is a reduction of cases that are referred for a larger inquiry. So we see that as a positive. There is a piece of work happening nationally at the moment, which is hopefully going to be complete in the next few weeks, because there is a recognition that each local authority is applying different levels of thresholds. So if something comes into a local authority and they decide it meets the statutory threshold for safeguarding adult inquiry, they will take measures, carry out measures to protect the adults. When that doesn't happen, it doesn't mean nothing happens at all. Other activity is undertaken, but it's not within the safeguarding adult space. So each local authority is responding quite differently to that nationally, and ADAS and the Local Government Association are carrying out a thresholds workshop to look at some national guidance on thresholds to help align that and make it more consistent. So I think it is important to note that although something doesn't progress to a full-scale safeguarding case, it doesn't mean we don't do anything. Appropriate advice, guidance, signposting, review of their care and support plan would take place in all cases.
Councillor Gardner.
Yeah, this is a really good report. Again, like Councillor Palmer, I'm pleased that domestic abuse, I'm not pleased that domestic abuse is in here, but I'm glad that it's being reported. I'm also glad that the reporting is going up, which means people are taking it seriously. On page 29, case study 2, it says, last year the adult social worker supported a man with profound physical and learning disabilities who was not being given the specialist care and support that had been commissioned. Who wasn't giving him the care and support? Was it us? Was it
No, it was
partner?
a commission provider.
Mm-hmm. And that's been sorted out. Fair
It
enough.
has.
Thank you.
Both in terms of the outcome for the person concerned, but also in relation to the provider that wasn't providing the care and support.
Councillor Edgington.
Yes, it's a very interesting report. A few points. One, I see that on page 18 there's some graphs which show the inquiry risks and the risks remaining. Although there seems to be, because it's in percentages, a relatively small number of cases, well, a not significant increase perhaps in the risks remaining. It's increased from 6.3 to 8.6. Actually, when you apply the actual numbers in each year, it's gone up from 18, I think, to 38, which does seem a very large increase. And similarly, with the risks reduced, there's been a significant increase in the actual number, even though the percentage has dropped. Is that a concern?
I think these figures demonstrate some of the more robust practice around what we call in safeguarding adults making safeguarding personal, which is a really fancy term which means speaking to the adults and asking them what they want to happen. So while we would work with the adult to reduce the risk, and that's demonstrated here in the figures, there are times, and if we're being honest, it sits uncomfortably with us as practitioners, as a social worker, where the adult will, for a number of different reasons, choose to remain living with a level of risk. And I think we've become more confident around our decision making. We've got more robust tools to support and provide defensible decision making, where actually the adult's saying, I don't want you to do anything, or actually, this risk will continue because of these factors. Now, again, it doesn't mean we haven't done anything at all. It's about working with the adult to minimise it as much as possible, but there are times where that would remain for the adult through their choice, taking mental capacity, undue pressure, coercion and control into account, of course.
Could I?
Oh, what are you asking? Another question?
Yes, but I'll wait if somebody else wants to ask.
There is. Could you just wait till Councillor Flynn is next, please?
Thank you, Chairman. I would concur with those colleagues who have expressed what a comprehensive report this is. I notice in the report some references to human trafficking, and I just wondered, one hears quite a lot about this in the news pretty frequently, and given our borough's fairly unique position, given the airport and being a border into the UK, how as a council we are addressing this issue, because clearly because of Heathrow it's probably a bigger issue here than it is in many equivalent boroughs. And also, are you seeing any sort of trends in that area? Are you seeing more cases of people being trafficked into this borough?
From a safeguarding adults point of view, in terms of adults with care and support needs, the numbers remain relatively low, but there has been some increase. Of course, you rightly identify this is around a council response, and this is a council-wide issue. It's one of the reasons that the human trafficking was identified as a priority for the year going forward. So we have started that work in terms of looking at how the different council departments are working together for a coordinated response. There will be some further work in this area, particularly working closely with our community safety colleagues and areas such as trading standards, for example. So we are starting to coordinate that approach much more robustly, but it is an area for priority over the forthcoming year. Anything to add, Claire?
No, I mean, just very briefly to add that we are engaged with the London network around human trafficking and modern slavery, and have identified leads at the moment within adults and children's services, and we continue to engage with that partnership. I think we recognise, as with a lot of local authorities across the country, there is work to do, because we don't know enough about what we don't know because it's very hidden, so we recognise that.
I think we've increased our work certainly over the last couple of years with Heathrow Airport in a much more hands-on way. Certainly has in terms of domestic abuse and trafficking. So I'm quite confident that we're in a better place than we were. Councillor Edwards and then Councillor Edwards.
Thank you very much, Chairman. A very quick one. Do you have any information at all on how many prosecutions arose out of the inquiries?
That's not readily available information, but I can certainly take that away and see what we do hold. It's not a statistic that we keep. I'm not sure.
Thank you. It would be interesting, it would be more than interesting to know that. I believe that we should be putting a message out that if you subject people to abuse of any form, there is a consequence. And I don't see that message coming through here. And I just believe that might be a helpful strengthening of our position. Thank you.
Thank you. I think Councillor Edwards makes a valid point there, that this committee likes very much to see the outcomes of the work and the justification, so that we can make recommendations to Cabinet based on facts and figures. So if we are in a position to have those, we would be grateful if that could be sent to our Democratic Services Officer, and then we can send that out. But I understand that it may not be available, but going forward, that's something we'd probably like. Councillor Edgington.
Thank you, Chair. Was a couple of points which I wanted to make. One was on page 15, and it's safeguarding adults concerned by ethnicity. For some reason, it only adds up to 84%. Now, it does say the 4 most prevalent ethnic backgrounds, but it seems to cover every ethnic background, because it says any other ethnic group. So, unless that doesn't include every other ethnic group. It would be helpful to know quite why that is, but I don't know. The other point which I was going to make was, I think it would be helpful when preparing glossaries, to have them alphabetical. If you look at page 30, having a random selection or a random list of acronyms, we might as well do dictionaries the same way. It'd be fun, wouldn't it? But but just having a random, I don't know how it's been selected or ordered, but it'd be useful to do it in alphabetical order, I would suggest.
Thank you. I'd just like to say that it's useful to have a glossary. I can remember times when we didn't even have a glossary, so I'm not hung up about alphabetical. I think this is pretty clear that we can see what it is, and thank the officers for that, because, you know, we all use internal language, and for me this is a progress, because a couple of years ago we had to keep asking what does that abbreviation mean, so thank you for that. Councillor Cooper.
Thank you, Chairman. And thank you, officers, for the report. It is comprehensive, and I would like to applaud the person-centred approach. I can't think of anything better. Can I go back to page 15? Because I, too, am puzzled, she says, having lost it, I'm puzzled by these figures. It looks as if there are a huge number of white British people compared with the other populations there who are registering safeguarding adults' concerns. Now, I don't know whether that is just the way they have been presented, or the fact that all the people aren't in the group, or whether in fact your other ethnic groups are underrepresented and we should be concerned about that. Could you explain, please?
Noting the question that's already arisen around the breakdown, I think that's something that we would like to come back to the group with once I've had a further analysis of the four main groups being represented, please.
Thank you. Are there any other questions? Okay, so that's just, let's just say, you know, thank you so much for comprehensive work. There's a lot that you can see, there's a lot of work gone into this, and it clearly shows us here that we are in a very good place for our safeguarding, and you know, that needs to be recorded. There's a lot of work going on here, and it's all very, very positive, and long may that continue. Thank you very much. If you can leave if you want. There's no reason for you to. If you don't have to be here, there's no reason that you need to be here. So please feel free to go. We can go on to agenda item 6, pages 71 to 78, which is the budget planning. Hold on. Hold on. Have I suddenly lost?
Sorry,
have I suddenly lost the chairmanship role? I'm not quite sure. Councillor Edgerton, how can I assist you going forward
We've got the
this
local
evening?
Safeguarding Children's Board report.
We have.
Which
Perhaps.
is under the same.
Perhaps you are more best placed to be chairman than myself this evening, Councillor Edgerton. You are more on the ball than I am. My apologies. Thank you. Let's go on to the next report that Councillor Edgerton quite rightly alerts me to the fact that I've missed it. Thank you.
Mr. Chairman, I'm Neil Esgate. Not quite. Okay. The report represents the details of the work undertaken by the LSCB in Hillingdon and the partner agencies in 2018 and 19. And it is the last report of its kind under the current arrangements and the LSCB arrangements. And it has been the LSCB, it focuses on the priorities and the safeguarding that that's carried out by both Hillingdon Children's Social Care and the partner agencies. The report was written by the independent chair, and in his foreword he identifies two areas that we need to take forward. One was in relation to neglect strategy, and then the second, the priority will be the adolescents and protecting adolescents. That includes CSC, trafficking, gangs, stabbings, young adolescents that are involved in criminal activities and so on. So those are the two priorities that we'll take forward. I wanted to focus on in relation to what happens next. So the LSCB took place, the last board took place sometime in June 2019. Although the arrangements continue until the new arrangements kick in sometime towards the end of September, some of the changes actually already, there are a lot of activities that are actually underway to implement the new changes as actually it's in the statute. So just to give you the context, in 2015, Sir Alan was commissioned by the then Secretary of State for Education to review the current LSCB arrangements. And Sir Alan Wood recommended some major changes to the LSCB as it is at the moment. And then he came up with the new recommendations. So the new arrangements, which is, it'll be under the Chief Executive of London Borough of Hillingdon, the Borough Commander and the Director of CCG. And underneath that there will be various subgroups and activities that will take place. All those arrangements currently underway. They're early days to talk about what it's going to look like because there is so much work to be done. But within that, I suppose it's important that I notify you, is the CDOP, which is the Child Death Overview Panel, that also which sits within the LSCB and under the new arrangements. So that arrangement, we became partners with West London local authorities. There are 8 of them, and that will be part of the new arrangements in terms of CDOP. The new safeguarding arrangements will be between Hillingdon, the police, and the CCG, and in Hillingdon. So those arrangements will be implemented, and the implementation date, as I said, is sometime towards the end of September. I'm not going through. I don't think I need to go through the report unless you want me to go through anything that you would like me to highlight. Other than those 2 issues that I think that was relevant for me to mention in relation to neglect and the adolescents. If you have any questions, then
I think it's
a
very, very comprehensive report, and I think it does need to go on record. Our thanks to Steve Ashley, who has, sat before this committee on many occasions and has continued to produce excellent reports. And we're looking at one now, and our thanks go to him for his time. The last 3 years he's done in this independent chair. So. Would like to have that recorded. It's an excellent report. Does anybody have any...
Didn't have to ask.
I'm just looking to my left, to my new Deputy Chair, Councillor Edgington.
Thank you. Thank you, Chair. I wonder, we talked, or you mentioned the new arrangements. Who will be accountable for the period from April to now, or to the end of June, in terms of reporting to the... Will there be a report? And then will there be another report for the new arrangements, or for the period from July to September, and then another one for the period from October to next March?
I don't like to be rude, Chairman. We'll weave it all into the one, I think, because there's no gap in terms of governance. The existing arrangements are in place. Steve Ashley is retained up until we have the new arrangements underway. Sorry, is that enough? Could I just add something else whilst I'm... I think it's just worth saying that it's not Zafar mentioned that there's been a combination of a review that was requested by ministers and then subsequent legislation change. And so that's no reflection on either what we were doing or what Steve Ashley was doing or anything else. But I think there are some points that it's worthwhile mentioning that sit underneath the reasoning. And they are that it was... I think there was a view taken that it wasn't getting into the kind of nutty issues of kind of operational delivery and what's making a difference. And I'm just characterising it in this way. Again, it's not a description, I'm just using my own words to illustrate, but where actually we were going through a process of having, reports about performance on sort of various things and everything else, and really that doesn't show you what's making a difference and how children are more sort of safeguarded. So the new arrangements are a lot more operationally focused. They're going to be there'll be a board that looks something like the one that's existed, and then beneath that there'll be subgroups. It'll be a little bit more inclusive. So, for example, youth offending will be a lot more integrated into that board. So we're getting intelligence from different areas in order to consider what priorities should be. And then above that, but rather than being something that meets for the purpose of meeting and just exchanging reports and everybody goes away and thinks they've done a good job, it'll be the chief executive, so Fran in our case, the borough commander, and now actually because of the CCG changes, it won't be the managing director of the local CCG, it'll be the West London safeguarding lead, who has a responsibility across the 8 CCGs in North West London. And their sole purpose will be for escalation, for unblocking, for for real material differences to be made in operational delivery, as I say, rather than just sort of turning up at meetings. I think it's also worth adding that Councillor Simmons was quite keen that written into the new arrangements was that actually the statutory responsibility for the lead member and in this case me, the statutory DCS, they don't change actually under statute. So Councillor Simmons was quite keen it was written in that the new arrangements are delegated from him and the local authority to be discharged, which gives him a right to at any point dip into any aspect of what's happening in order to give assurance to members. So I hope that helps just as a sort of contextual overview. Sorry, can I?
Councillor Flynn.
Sorry. Could I just?
You can.
Sorry.
Of course, always.
And just to mention that we also agreed in the cabinet paper that the same arrangements would follow for adults. So what I'd say on the back of the adults report, thank you for your kind comments, but one of the things that we struggled with is to get partners to be more meaningfully engaged. So for example, if we look at some of the information that we've had from CNWL about mental health services, if we look at some of the information we've had from THH about hospital admissions and discharges, it's not good enough, frankly. And in fairness to Steve, in the current arrangements, he hasn't got the time to go around beating the doors down of, otherwise we'd be paying a fortune, because obviously we're paying for a number of days to provide the independent governance. So the arrangements being mirrored in the way that I've just described give us a real opportunity to talk to the lead for North West London as the Commissioner of Acute Services to say, actually, your responsibility to get the hospital delivering the information to us that we need to give us assurance, similarly for mental health services, etc. So I think it does add a whole new level of robust challenge into the system that's not been there previously. Sorry for that. Thank you.
Thank you.
Thank you, Chairman. That answer leads quite neatly onto the question I was going to ask about partners. I notice in the report quite a few references to Hillingdon Hospital and also, obviously, the local schools. My question really was, where you have a child, for example, who may not necessarily be using Hillingdon Hospital, if they live, say, in the north of the borough, they might just as easily use Watford Hospital. It's probably nearer than Hillingdon in certain areas of the borough. What are we doing in terms of engaging with CCGs outside of our borough when it's our residents who are using those? Or it could be a specialist, a child that requires specialist medical treatment, for example, using one of the central London hospitals. So what are we doing to sort of get that information? And also, from a school's perspective, it could be that children are being educated outside the borough, particularly if they live on the edge of the borough. So what information, how are we going about getting information from schools outside of Hillingdon, or is that just falling between the cracks?
The arrangements that actually that's underway, and the arrangements that before under the LSCB, it's not really changing in terms of the practice. So a child that actually attends school outside Hillingdon, or a child that attends hospital, another hospital other than Hillingdon, then the normal working together safeguard children processes and the legislation still applies. So there is no real change operationally in terms of safeguarding children. That will be a referral process. And in terms of the communication, so every local authority, every CCG will have similar arrangement to one that actually we got in Hillingdon.
And I mean, a good example would be, so we do have, we've had occasion where we've had quite a number of reasonably high-profile cases of Great Ormond Street, for example. So we follow that and engage with it, and of course wherever the child is registered GP-wise, again that health follows it because it's a referral from that CCG to that specialist hospital. So it's.
Councillor Hagger.
Thank you, Chair. Yeah, really good, solid report again. I think, when you sitting here a couple of years ago, you guys have done really, really well. Page 18, about 4th paragraph down. I just wondered again if you could explain the figures, very similar with the adult one actually. We've got 2018-19 children's services received 15,741 contacts relating to children. And then we go down to say there was an increase in early assessments, which is fantastic. But what about the ones that are left? So out of the 15,000, if I'm doing my maths correctly, we've got 336, 5,645 and 12. Is that right? Could you just explain that to me, please? Oh, right, okay. So page 18, 4th paragraph down. It's just after the quorum voice. Yeah. Could you just explain that piece for me? I just wondered, is it 15,741 contacts relating to children? Yeah? And I just wonder where the rest are. So I can't quite add up to 15,000. That's what I mean. Does that make sense? Does that make sense?
So
not me.
Number of contacts, 15,741.
That's it.
And it increased in I haven't actually added the math, so I'm not sure if we together.
Could you use your mic, Tony, please?
Sorry, Chairman. At that point in time, so they'll come through as a contact. So some will be immediately either stepped down or no further action because actually there's nothing more to be done. They could be signposted, etc. So there's a whole range of outcomes that don't result in an assessment. So it's not because I think the current conversion rate is around about 30%.
Okay.
In terms of to a referral, so 30% of those will become an assessment that we recognise is either a.
Sorry, Tony, I understand that. I think what my concern is exactly where they're going and what signposting. I know we can't have, but we're talking about a large number here. We're talking. I haven't done my figures, but is it something like something like 10,000? I'm not sure, but it's a lot. We're not talking about a couple of hundred. And I think my question is where, I know there's some, can we be a bit more specific? Because I see that as a lot of referrals coming in that are unnecessary, which would then lead me to question why they're coming in. I'm just a little bit unclear about
it. Yeah, understand. Sorry to get sort of technical about it, but so a referral is something quite specific as opposed to a contact. So, for example, we get any number of contact. Merlin's would be a good example. So we get any amount of detail that comes through that is a contact that actually isn't either material or significant or even appropriate for children's services to deal with. So there's a whole range of things that come through. And one of the things that we need to get better at, one of the things we try to do is to have people referring in get better at knowing whether it is something that should be made as a referral. So it certainly isn't that there are things that you would look at and think, oh crikey, they're just putting a pile of things over there that they should be dealing with. They are things that don't meet thresholds, and not even thresholds for either team around a family or any of the early help solutions that we might have. But there will be a large number of those that are signposted to a range of other services as well that won't be included. That are included in that sort of, if you like, that missing label that's in here.
Can I just add on that? So in relation to contact does not mean referral. Contact means it could be an open case that you receive a police notification, for example, or it might be that, I don't know, a child presents school and then there is a further concern, they refer it in. So that would be on an open referral, that would be a contact, so that also adds on as a contact. In relation to contacts coming in and signposting, some local authorities would be, if it's not relevant, if it doesn't meet the threshold, they will close the case. In Hillingdon, which were actually complemented by Ofsted, and many other local authorities actually taken as an example and exemplary, that every contact is actually actioned by us into the signposting. So we never NFA contact unless there is some form of activity that actually undertaken. It might be referral to some other agency, it could be referral to CAMS, health, whatever that referral might be. It will actually, there is a signposting and providing that advice. So you wouldn't see NFAs, for example, contact NFA, you will see an action, and the action will be almost a hidden referral within the contact, really. So that you will, that some locals you may see contact NFA ratio, no further action is very high. That's not the case in Hillingdon.
Councillor Gardner.
Yeah. First of all, thank you for this report, and thank you for finally taking children who are the children of victims of domestic violence, taking that seriously. Because for a long, long time, I've been going on about the children of victims are also victims themselves, and finally people have woken up to that. So I'd like to thank you very much for that, and also it's great that the domestic abuse steering executive, we're getting our heads around the way that children are being tortured basically by the things that they hear and see. So I'd just like to say thank you on behalf of just about everybody I represent, to be perfectly honest with you. Thank you.
No, I would echo that. Obviously, Janet and I work really closely together, and in one of the serious case reviews, I've highlighted it here, lack of understanding of impact on young person living in a household of prolonged domestic abuse. And I think we are just beginning to do some really important work about what is going on behind doors, not only for women and men, but for children. And I know at the support groups that we have there, you see at first hand the children come, and I think we can do some joined up working in this council with what goes on there, because certainly over the last few months we've seen some really traumatised children, and we're just beginning to do some really, really important work. So I think it is, I would echo what Councillor Gardner's saying, it's fantastic that we also put children, we involve our children so well in all areas of this. Not only, it's not that we involve them well there, but we use our children to improve our services as well, and that's highlighted in the report. Something that we should be very, very proud of. We use children to use isn't the right word. We encourage and benefit from our children going out and inspecting our services and things like that. So this report is absolutely fantastic. Councillor Edwards.
Thank you very much, Chairman. Thank you for the report. Much appreciated. A few things around the serious case reviews. Firstly, could you explain the difference between a serious case review and a learning review? What's the threshold for those? Secondly, can I have assurance that this sort of detail will be coming forward in future reports? And thirdly, what is the process that you have for picking up the learning and ensuring that those lessons are driven through the staff? Because some of these issues seem to be pretty common and repetitive. Thank you.
Okay, I'll try to remember all those questions and answer them one by one. In relation to the difference between serious case review and learning reviews, serious case review refers to a child death, so following a certain processes and steps that one has to follow following a child death, and then decision whether there should be a serious case review or not. So that's the serious case review. Learning reviews is more in relation to there may be complex cases or there may be a particular situation in relation to an individual case that there may be some learning for children's social care and partner agencies. So that would be the learning reviews. And if I were to give you an example, for example, there might be that, we mentioned domestic abuse earlier on, it might be that something actually went not according to plan, and maybe the quality of intervention by all agencies wasn't as far as should have been. So we could make a decision in consultation with under the new system there's a different panel. So there is you have to then have a consultation with the national panel to discuss in relation to before deciding whether a case actually fits serious case review or a learning review. So that's coming back to the example. It may be that actually we decide to do a learning review, so to look at what went wrong and how can we improve the service. So that would be the learning. And you take those learning from the so as part of the learning review and the serious case review, there will be an independent person who will undertake the review on behalf of the partner agencies, and they will come up with a set of recommendations and learning. That learning then will be cascaded through the organisation and partner agencies.
Thank you.
Does that follow?
To a degree.
Yeah.
Are you saying that each child death results in a serious case review, in which case are there 20? So how does the process kick in? What's the threshold on each of those? And then more particularly, what is the actual process? I know that we cascade it, but that's just words.
Following a child death, so there are children die for all sorts of different reasons, natural causes and so on. So every time there's a child death, there'll be a rapid response team, which is already as part of the subgroup under the new arrangements and under the old LSCB as well. So if it's a suspected death, then there would be then serious case review. So you wouldn't undertake a serious case review for children actually die of natural causes, for example.
So I can conclude from this report that there was only one child death that was suspicious in the year. Is that what?
Correct. So there is one child death and 2 learning reviews. Correct.
Thank you. And the process, I mean, do you document a learning plan? Is it actioned? Is there an action plan? Is it signed off? How does this happen?
Yes, there would be as part of the learning, and once the report is available, there will be a set of actions and learning there would be that learning that's cascaded to all relevant agencies who actually took part in the investigation. So what happens when there is a serious case review? Every agency actually involved with the child and the family, they submit what you call IMR, internal management review. So they review the case, and those information then reviewed by the independent person who's actually undertakes the overview of the case, and then there will be then learning for each agency.
Councillor Cooper.
Thank you, Chairman, and thank you, officers. Again, very good. If I could just underline the things that I think are really good in this report. We're still talking about the team around the family. I'm delighted. We're still talking about early intervention, so we should be. And you're talking about the voice of the child in here. So that's all good news. And just by passing, I thought that the youth offending figures were very good, and I think they deserve compliments because they have done very, very well. After that, it might seem to be nitpicking, but I'm on page 12 of the report, section 7, and we're saying that only 43 of our schools have responded. Now, that is just over half. I don't think that figure's changed in all the time that I've been on this committee, frankly. It suggests that there is limited interest and awareness in the importance of safeguarding. Now, I wonder whether we have taken the time and trouble to have a look at these schools' Ofsted reports and see if any safeguarding concerns have been raised there, and whether we have in fact actioned them. And just As an extra, on the next page, we've got the same kind of thing where we're looking at the training programme data and, for example, early help in Hillingdon, which, of course, I would think is really important, wouldn't I? But there's only been a 50% take-up, and that is disappointing. I hope you're going to be pursuing that. There are a couple of others that are rather low as well. But it's really this point about the schools and how we engage with them, because until they start taking it seriously and engaging with us, how can we know what's going on and whether our measures are truly effective?
Thank you. Just in terms of the early help, hostage to fortune comment coming up. That will be significantly increased next year. So we're doing an awful lot of work at the moment in terms of looking at. In fact, we had a session this morning with our CCG colleagues about a much more single door across health, social care, the whole raft of things, and actually linking that into schools. One of the challenges that we have is that schools are in a different sort of place now in terms of their degrees of independence, and to some degree, schools engage with us when they have a problem, rather more than trying to avoid the problem. And that's not all of them, I have to say. I'm not going to, but I'll give you an example. The other week we held a session about knife crime, because obviously, significant issue nationally in London. Not so much for us compared to sort of others, but nonetheless it's there. And we had a handful of schools that turned up. Those that did, very interested, very engaged. But even a couple that were there, well, not quite our issue. We have Jemima coming along with an avocado knife. I'm not quite sure that's the same. Well, on the one hand, amusing, but actually it's a serious issue, and it may well be. I'm assuming the children that go to the school that this person was representing, maybe slightly more sort of well-to-do. Well, then they may be the ones that are being targeted. So actually, there is a vulnerability, and there is some work to do. I have to say that's not because we're not doing the work. So, for example, Dan Kennedy would talk to you about the newsletter that goes out where there's routine information in about risk, vulnerability, and so on. The work that we're doing around risk and vulnerability, and the Axis project. Which have you had the Axis project? I might proffer that could be something for the future, because it's a new approach that we won. I don't know if you saw that at the Municipal Journal Awards, Hillingdon won the sort of Innovation in Children's Services Award, because it's an approach of looking at gathering intelligence and information and identifying patterns of behaviour of children at risk of exploitation.
I had a presentation on the Safeguarding Hillingdon Partnership. It was excellent, and it is something that I would recommend that we have for this committee.
It's stunning. And so we're doing an awful lot of work around this, and actually the adolescence team now that we've sort of developed in the service. So we're changing with what's happening in terms of what we can see, the changing sort of patterns of behaviour out in the communities. The schools are a little slower sort of coming to it. If I were to say in fairness to them, one of the challenges that we have is because they are all independent as such, actually trying to get them to sort of coalesce around a point and collaboratively think about it is quite a challenge. I have a degree of sympathy, but equally, and so we're reaching out. So Julie's been out, Julie Kelly, one of our assistant directors, has been out and visited a number of schools already. So we're routinely doing that, but to some degree that's very sort of one-to-one, and we don't get to that where we can sort of gather ourselves into an action against something that's prevalent in the borough. So I'm sorry, I'm waffling on a bit, but it is a challenge, and we do need to think about, and we are thinking about how we deal with it. So and the new arrangements again. So we have Hillingdon Secondary Heads Association, HASH. That's obviously, I didn't say that in the right order, but and there's one for juniors, but they're not massively representative. They don't represent a whole constituency as such. of head teachers, it's just a sort of small number. So it is a challenge.
I think it's some work that this committee needs to think about, because we've struggled at times to get witnesses from schools here, and it's been quite difficult, term time or holiday time, that sort of thing, and we're trying to be, we don't want to be reactive, we want to be proactive. So I think we need to think about how we're going to change that sort of mindset. Councillor Edwards, you wanted to talk about this
just on that particular point. Yeah. Tony, do you copy in the safeguarding lead, the governor, these communications? Because it would be something that, as a member of a governing body, I would be interested that the school has been asked for this information by the local authority, and I would be interested to know what the school's response would be. I would say no more than that, but I think sharing that sort of information with governors might be another way of just tweaking the pressure on schools to respond.
Thank you. Councillor Edgington.
Thank you, Chair. Yes, I think the report from the Children's Board has improved over the years significantly. I think there may be a few errors in it. Page 69, for example, the headings seem to be for the wrong year, but I guess that's just a mistake. Also on page 61, the number of children's centres, I think 17 was the number we had a few years ago, but 2 have closed since then, so it's 15, I think, at the moment, because there aren't any in Northwood or Northwood Hills anymore. But more importantly, perhaps, the CDOP, the Child Death Overview Panel, I was a bit concerned that I appreciate those relatively small numbers, but the fact that no families have contacted CDOP regarding sharing information is a bit of a concern, I would have thought. It would be nice to hear from the families whether either they can be helped or indeed their views could help the council in trying to prevent similar deaths. It would be useful. I don't know whether it's possible for us to see a copy of the leaflet which is handed out. Obviously there aren't many copies sent out, fortunately, because there aren't too many deaths, but everyone is important.
As part of the practice, whenever there's a child death, I'm talking about child death that are actually natural causes. There's a process that we follow through, including actually our lead officer. You mentioned the schools earlier on. We have a lead officer, someone called Susie, that she's the lead officer for all the schools, and she does actually reach out to many schools, and part of her work to continue to actually build that relationship with all the schools, including independent schools. So in relation to CDOP, it's an option, so the information will be given to the family, and they have the option to get back to CDOP and share information. It's a personal choice, and I think we could review the information they receive, but I just want to kind of come back to the point that it's a choice that they make.
I appreciate that entirely.
Yeah.
It's just that on the basis that you get no information back, it surprises me that you get no response at all. It will be, whether it's the leaflet itself, I don't know. But I would have thought that even bereaved parents would perhaps want to help to prevent future problems, and whether...
We certainly can take something that we can take forward under the new CDOP arrangements.
I think it's, people deal with bereavement in very, very different ways, and what we may think around this table is, in my other role, we all deal with it differently, and some of us engage immediately and some of us engage much, much later down the line. It certainly doesn't hurt to see a leaflet, to see what's going out, but I would expect that that people are just processing a very, very difficult situation in life. And we must allow that to take its course. But I'm sure that we are providing all the suitable signposting that we can in these matters. Are there any other questions, or can we, Councillor Gardner? Councillor Edgington, last question, please.
Slightly more serious. On the serious case review, on page 65, the second bullet point, I didn't understand that, and perhaps it says the role of CAFCAS in work to first hearing and work after first hearing is not understood. I didn't understand what that meant, but...
It's actually it falls within the private law proceedings. So whenever there is, it's quite complex and operationally, if I could try to explain to you. So when following a parental separation, and when one parent makes an application to court in relation to contact or residency, then under the private law pathways within the court arena, within CAFCAS is required to produce what you call before court letter. So it's a kind of short letter undertaking initial safeguarding checks. So those are checks with in relation to child and both parents, both in relation to where the parents might be living in different addresses and different local authorities. So those goes to different local authorities, and they provide what you call before court letter to court to make decisions. So I think that refers to that process. I hope you can understand that.
Thank you. I think I'm going to draw this to a close now, this agenda item. So thank you very much. Oh, yes, Tony, before I do. It's one of those nights, isn't it?
Sorry, if I may, just, I'm not wholly sure if it's appropriate. I'm sure somebody will tell me. If not, I'm not going to be outrageous. Just a bit of a sentimental moment, really, if I may. So we're at this point in time, for those of you who are aware, so Anna Popovici is leaving us, as is Emily Wright, who is our head of SEN services. Both, I have to say, to brilliant opportunities that, and just to both of them, actually, Emily in a much shorter time, Anna over a sort of longer period of time, have made real step change difference in their service. I mean, really stunning, and by some degree, two of the most brilliant people I've come across in my career, so I'm privileged. But similarly, I think we should take some pride in what, the opportunities that sort of we've given them, and to put them in the position they are to have secured the roles that they have. So I just thought, if you don't mind, I wouldn't mind having that minuted.
Not at all. I think that this committee, I think, would agree that the role of those two ladies, in particular Anna Popovici, has turned services around in this borough, and we'd like to wish her well in her new role. Wandsworth gaining, it's our loss really, and Anna has been a fantastic support to me personally in my role. And yes, it's a sad day, but we wish them well. They've deserved it. We've shown them what a good council's like, and hopefully they'll return at some stage. So we have indeed. So we wish them well. That's part of what that sort of role is. But we acknowledge that things are in a much better place thanks to them. So thank you for that. Thank you to the officers for that report. It's absolutely superb. Thank you, Zafar. Yeah. Thank you, Tony, for being here tonight to answer questions on that. And if there's no reason for you to remain, please go and leave. And that just leaves Peter on your own to agenda item 6, the budget planning report for services within the remit of social care, housing and public health, please.
Yeah, thank you, Chair. Again, I'm not going to go through this line by line, but I think it is worth at least just pointing out some of the key challenges I think that we face as an authority going forward. And I think it would be useful just to sort of pull out some of those points. So this is a very high-level report, and it is effectively just setting out the challenge ahead, effectively, for the years 2021 to 22-23, effectively. Over that sort of period, it says here in the report that we're looking at delivering savings in excess of 28 million. That is assuming that we actually have council tax is raised by 2.99%. So actually the savings figure is nearer to 40 million, actually, depending upon the decisions that are made. I think also it's worth noting that there is a slight change a little bit in the way in which these pressures are now arising. So in the previous sort of 4 or 5 years, inflation actually has been quite stable, quite low actually. Pay inflation in particular has almost been at zero in most cases. We're now starting to see some significant pay inflation coming through into the system. And that actually extends itself also into our sort of contractors that we work with as well. So again, the National Living Wage, London Living Wage, we are seeing significant increases in that, and we're having to make decisions around some of those sustainability issues that we're having with the marketplace effectively. So for the first time, actually the challenge in this particular 3 years coming is very much around actually an inflationary sort of pressure that we're seeing in the system. And that is predominantly driven by sort of pay inflation. That's generally the thing to point out, which is a real different change to where we've been previously. And that actually does change the way you have to behave and act actually as well in terms of your approach to the market. The other thing to sort of point out is that our sort of capital programme does actually now, it's starting to see some sort of impact of that sort of investment, and we are starting to see an increase in our capital financing costs. So in some ways, actually, the historical decisions that we've made in terms of massive investment, predominantly around the schools programme, actually. So bear in mind that we sort of quote a figure of 150 million plus, don't we? That wasn't fully funded through sort of government department grants. A lot of that was actually funded through council resources. And what you're seeing is the impact of that in terms of capital financing costs going forward. So I think it's worth just sort of pointing those two things out. I think the other thing to note is demographics. So it is an interesting perspective, again, when you look at Hillingdon, because I've got to say, when we look across the country, Hillingdon doesn't have a similar trend, or hasn't had a similar trend in terms of growth in the system. We've been able to sort of almost manage that and buffer it through things that we've been sort of planned to do over the period of time. But there is a point in time where a genuine sort of growth will come into the system. And I think in particular in the next 3-4 years, there is a probability that we've done everything we physically can, and therefore we are now going to start seeing sort of demographic pressures coming into the system. The 3 areas which are obvious, well, I hope they're obvious, is children's services, adult services, and the other one is SEN transport. The other one noted in here is waste as well, actually, and I think that is worth sort of noting that those things we're now having to deal with in terms of the demographics, so they are the growth sort of items in the system. In terms of how that's sort of being funded, so when this was presented to Cabinet in February, effectively one of the sort of assumptions that was made is that there was a spending review and there was a fair funding review. As you probably are aware, those things have slightly been put on hold and slightly been pushed back a little bit. So there is a little bit of uncertainty going on. So within the budget strategy, there were some significant shifts in the level of funding we were assuming going forward. It is less clear at this point in time whether those are still actually going to happen or not. So there is a risk around some of those sort of things that we've anticipated. I think the other thing to sort of bear in mind is near the sort of back end of this report, it does actually say over the last 5 years, so up to 1920, this authority has delivered 53.5 million pounds of savings. So what does that mean? Effectively, that means that therefore future savings that we've got to deliver are actually obviously going to become harder to actually identify and predominantly have a longer lead-in time as well, because they are much more complex and much more complicated to deliver. So it's the low-hanging fruit, the medium-hanging fruit, and now you're at the climb a ladder type sort of approach really, because they are actually very challenging. that is not a Hillingdon sort of challenge. It is a local government challenge, and we're all hopefully fully aware of that. On the plus side, then, there are some pluses. So in terms of other funds, so housing revenue account, actually our housing revenue account is quite stable, and we have, I think it's the 30-year strategy, does indicate that actually it's a very sustainable fund, actually. So that one in particular, I think, in terms of the way we've developed our strategy, that seems to have a very long-term future in terms of how we're sort of developing it. I suppose the big challenge, which again I think the sort of central government are slightly struggling with in terms of actually trying to understand or how to actually resource it, is the dedicated schools grant. And again, there's a sort of narrative here which sort of sets out some of the challenges. So we're seeing across the country there are some significant pressures coming through high needs. So that's children with, in the olden days, statements, now education, health and care plans. The growth within that sector has been at least over 10% across the country. And indeed in Hillingdon it is running at about that rate, actually, in terms of numbers of children who increase in the number of children who have a plan. That has in itself a significant financial impact, because along with that, what we're seeing as well is that you reach saturation points within your own local provision, which then means that you have very limited choice and availability locally, which then means you have to place out borough, or in most cases actually what we're finding is independent school placements, which obviously the cost differential is quite significant. Hillingdon's dedicated schools grant actually is in deficit. It ended the financial year in deficit by about £8.5 million. That meant that we had to submit a deficit recovery plan. We were one of 30 local authorities that had to do so. That's gone off. That's been submitted. Within that, we had to demonstrate how we thought we were going to address that cumulative deficit. Basically, our sort of biggest challenge for us is that we've got a lot of activity that we've identified, but in some respects the challenge is actually even setting an in-year balanced budget, let alone trying to manage the sort of cumulative deficit. So what we understand is the DfE will look at that deficit recovery plan over the summer break. They will then get in contact with each of those 30 local authorities, and then they will sort of try and assist or discuss with us how we're going to move things forward effectively. So I think one of the big challenges that we have at this point in time, let alone the savings that I've identified, is that we have also this sort of undecided sort of cumulative deficit, because at the moment the bit that the law says is it's ring-fenced. So the complication is therefore whose responsibility is it to actually manage that deficit and deal with the cumulative deficit. And I think that there's a bit of an interesting challenge around that in terms of the definition. So I think for Hillingdon, I mean, we have to almost effectively wait and understand what the legislation is that may come out of this. But what we do know is it is directly linked, and we've proven this ourselves, to the funding that we've been provided to support children with plans and the actual cost of those plans. And there is a significant gap nationally, and it's not just a Hillingdon issue. Admittedly, Hillingdon is in is one of the 30 out of 150. However, there are, I think it was 60 authorities that had a significant overspend in 18-19. So I think what's happening is the country is catching up to our position, if I'm honest. So I think from that point of view, there are some real challenges in terms of our budget setting process. So a report, obviously council gets an opportunity in December when the full sort of budget reports are presented, and then this committee will then in January get its opportunity to look at all of the savings proposals that are being put forward, and we'll be able to then sort of discuss those in more detail. So as I said, very high level, sort of setting the scene really. Hopefully I've sort of given enough information, and welcome any questions.
Thank you, Chair. It's a bit of a challenge this coming year, isn't it? What proportion of that 14 million do you think will have to come from social care and public health and housing?
So we as a local authority, we don't work on the premise of setting savings targets, actually. What we do, and actually set out in here, is we have a bid programme, effectively a transformation programme. So effectively there's a requirement placed across the whole local authority to identify savings. There's no notion, because actually if you set savings targets, a lot of authorities are caught out actually, because as I sort of said near the beginning, what we're starting to now see is much longer lead-in times to be able to deliver savings because of the complex nature of the business we operate and we run. So we don't go around actually saying that's a savings target, you must deliver this. We actually rely on services to plan over a very long period of time into the budget process. So in some respects, the reason why you have a 3-4 year MTFF is to really give you that opportunity to understand your strategy and your programme of savings delivery.
Could I ask a supplementary? So, as I understand it from that, you're talking about long term, which I assume is, as you're talking about, several years. So what are the plans over the last 2 or 3 years which have been developed which will affect social care, housing and public health?
So, as I think again I mentioned, one of the things that we have taken the opportunity of doing in terms of social care is looking at the demographics. So it's the management of the demographics. So it's effectively ensuring that people receive the right care at the right price for the right time, effectively. And so over a long period of time, the strategies that we've developed, so they aren't strategies that are very short term, these are very long term sort of strategies, is that we're starting to see a very different change and approach to the way in which we meet the needs of individual clients. So one of the things that we've looked at is, are those individuals being funded appropriately by the right organisation? Because it's not always the council who has to pay all of the care. And in some ways it is an element of whether the health service are paying their right share, fair share I suppose, if that's one of a better expression. And we've benchmarked ourselves as well across a lot of authorities, trying to understand where there are opportunities within the demographics in particular, where we can then start to see whether we're doing that or we're not doing it. So from our perspective, that's our sort of strategy really, is we're looking actually quite long term in trying to manage demographics predominantly. Where opportunities arise in terms of reviews of structures, they are again planned in year. So what we try and do is we give ourselves almost a year's grace of developing a saving, so that when we actually come to the new year, that saving's delivered actually. So I guess in some respects what we're doing is we're almost planning 18 months, 2 years here. So the things we're doing now probably actually won't impact until 18 months, 2 years. So we've already done a lot of the work. So I think from our end, that's how we're actually developing our sort of savings programme, is effectively we've already sort of done a lot of it, because that's how we're trying to work. Because what we don't want to do is to have a savings target that then means you've got to do something to deliver it, because actually that's a massive risk. And I think a lot of authorities have found themselves in that position, if I'm honest.
Thank you. Anybody else want to comment? Okay, so thank you very much. I mean, you know, clearly a difficult, very full explanation of what's going on. Thank you, Peter. You're off before I finish thanking you. Have a nice evening. We go on to the agenda item 7, which is our committee review. We need to be looking now at recommendations to go before the Cabinet. So if we could all give that some attention and some consideration, we need to go away with a couple of recommendations. Councillor Gardner.
Can I make a recommendation that we had DWP turned up a couple of times? I would like them, if possible, I don't know whether it is possible or not, to get a representative from the DWP to go to the different community organisations in the borough to explain the complexities surrounding universal credit. I was going to get in contact with them about the CAB, but I've had a lot of other stuff on my plate. I put my hand up, so I didn't do it. But I think we need to get a list of all the different community organisations in the borough that would benefit from having somebody from the DWP to talk to them. I don't know how we can...
we need to think about how we can put that, if the committee feel that that is something that we all agree, we need to think about how we can put that into a recommendation. I think what what we heard was what they said they did with their outreach, and some of the implications of what actually was going on was not quite tied up in completeness. So are we saying that we'd like a recommendation that they are to expand their outreach? I mean, how would we put that? Yeah.
I would like them to be able to go to different organisations for people to ask them questions. So rather than them give their spiel, I'd like individual members of the public to say, well, okay, what if I do this? What if I do that? Can I do this? Can I do that? So that they can answer, which is, I think would be ideal, because the amount of people that must ask all of us as individuals, how do we cope with this different thing? I don't know the answer to. I don't work for the GWP, but somebody with the qualifications, I think, should be able to do that.
Councillor Flynn.
Thank you, Chairman. I think it's very important that when we frame these recommendations, that we do so in a way that does not look at things that are outside the remit of this committee and this council. I am slightly concerned that the opposition members will seek to use this report as a way of critiquing the government in a way. Well, hang on. Let me speak. I've let you speak. This should not be an exercise in criticising the government or the DWP. It should be looking at what this council can do for our residents to improve their experience, which we've heard from a number of witnesses has not always been satisfactory. But I think we've just got to be careful not to go outside our powers, because we could produce a report criticising the DWP, but ultimately what influence will that have in changing policy? It won't. So we have to restrict this to our own activities as a council. And one thing that did come up was around publicising universal credit, the lack of awareness. So using things like Hillingdon People and you getting more information at our libraries, for example, that is the sort of thing that this council can do, and it's within our remit. Also providing potentially more support for people who don't necessarily have access to information technology or need extra support in that area. Again, that is something that we can do, I think, within the remit of this council. So I think it's got to be practical, common sense ideas rather than using this as a way of gesture politics.
Yes, I'm going to allow some answer to that. Which one of you wishes to?
No.
I wasn't. Well, universal credit we've got to live with. I acknowledge that. I was asking if the DWP, a member of staff, could go down to. I've got no intention of using it as a political football. Universal credit is there. We've got to live with it. I'm thinking of ways that we can make our residents make it easier for them. If you want to make it into politics, go for it. But I wasn't. I was worried about our residents. Okay,
and I think this is what this committee is to do, is to look at the implications of the universal credit. We are where we are with it, and that is what we are doing. What we can do, because we've in some of the recommendations here, we're talking about strengthening collaborative work between key partnerships, such as the DWP, the CA, Mind and council officers. I think that's something that we could incorporate what Councillor Gardner is saying into that recommendation. I'm going to go at Councillor Haggart and then Councillor Edgington.
Thanks, Chair. Just two things. We use Colin Morris from DWP to come and talk to us. So there is someone there that will come and talk to the groups. I can pass you over his details, actually, and he will come around and talk. So that's that one thing. The other thing is I completely agree. For my point, it's about the collaboration of working together. but also from cases that I've had recently as well. It's about the council tax, it's about the rent, all not being paid because the universal credit has gone AWOL or it's not been granted. So I would like to see in a recommendation that we actually put note on council tax and our rent here, you know, like our visitors here and a council tax. And when I have been in, I'm sorry to keep going, but when I have been in to help someone, we have nowhere here that someone can come to. I went into the housing office, I think it was, or downstairs by the council tax, and we only had one person on who couldn't actually deal with the query. So we have, and they're just computers again. There's no person. So if you are computer illiterate, even here, there is nowhere, and you can go down and have a look. We can all go down and have a look inside, and I think that's really important.
So we need to look at some sort of recommendation that deals with people who are unable. I mean, that's been the struggle, hasn't it? The computers have been a part of a stumbling point here. So we need to look at something, a recommendation for those residents that are unable to access computers due to disability or all sorts of things needs to be in the recommendation. Did you manage to get that in your... Councillor Edgington.
Thank you, Chair. I don't disagree with the view that we shouldn't... Universal credit has been criticised so much nationally. There have been so many reports, parliamentary reports. It's really unnecessary for us to make any comments on the scheme, the way it's been implemented. I could go on, so I won't. But what we do need to do is to try and ensure that for our residents, those who are entitled to claim and those who wish to claim, that there's support given. And it's quite clear from the evidence which we received over the months, and it is many months, almost a year now, that the rules which have been implemented by the DWP do not allow sufficient support to people who are vulnerable, to those who aren't able to access the system online, which is effectively the only way in which they can make a claim. And often they are refused, or even if they think they can achieve it, they fail. And we've heard that many times from the various witnesses. So I would hope that perhaps one of the recommendations could include some sort of additional funding provided by the council. We've heard about all the problems with budgeting, but nevertheless, this is an area where there is an interest for the council to provide support, because a lot of these people will be either receiving housing benefit or potentially could end up evicted or homeless. So I don't know whether it is possible to provide some support through the CAB. I don't think there's any point, because hopefully it's not going to be long term, but nevertheless it would be helpful to try and provide some sort of support, some funding to CAB to provide ongoing support for vulnerable people who the CAB believe, or the council believes, social services believe, need the extra help.
Thank you, Councillor Edgington. Councillor Cooper, then Councillor Edwards, please.
Thank you. I've got absolutely no problem with that. I think it is the right way to go. But I would say that I think that there are some very inefficient practices within the council. So, for example, as soon as they get information from the DWP that they've had the benefit chopped, they whack in straight away with cutting of housing benefits, cutting of charging council tax, all those kind of things. And then 2 weeks later it's, oh, well, we shouldn't have done that. And then you have letters going to and fro telling people that they are in debt, or they're not in debt, or they should be paying the council back, or they shouldn't. Now, if something was sorted out there at that level, the council could save itself a whole small fortune, and that might very well mean that some of the funding could be vired rather than having extra funding, because I think that is probably unlikely. But you could be sorting out the funding so that you weren't wasting money on having to keep changing what people think they owe the council.
What would that look like, Councillor Cooper, as a recommendation?
Yes. Okay. Somewhere I have... I don't know.
Do you want to think about it while I go to Councillor Edwards? Because what you're saying is what you're saying is valid, isn't it?
Yes.
Are we saying extra people within the council?
I think that officers need to review their own practices. Officers need to review their own practices with how they're treating people who are taken off benefits.
Not necessarily putting money before it. Councillor Edwards.
Thank you, Chairman. I'm not going to come forward with any specific recommendation. I will comment, though, that the recommendations we do make should be focused on the work of the council. To make a recommendation that DWP does X, Y and Z won't get past base. That is a matter for DWP to deal with, regrettably. Where we can bring around improvements, it should be recommendations on how the council can improve. And having heard from Peter and the challenges before us, to make suggestions that we throw money at it is not going to be a prudent recommendation in my view.
No, I think what we're looking at is much more liaison work, isn't it? And maybe people need to sort of concentrate on putting their own house in order a little bit. I understand the point that's being made. We are where we are with it. Whether we agree with it or not, our residents are suffering the impacts of it, and we need to mitigate it for them. Councillor Flynn, and then I'm going to go to Councillor Cooper. Oh, go on then, Councillor Cooper.
My words, okay?
Yes.
My word. Recommend that officers review their own practices in relation to residents' changes in benefit status.
That's pretty comprehensive. Did you manage to get that? Councillor Flynn.
Yeah, I just want to say, Chairman, look, if what I just said came over as a bit terse, I apologise to the opposition members. I just felt we needed to make it very clear, as Councillor Edwards said, that the remit of this report has to be within what the council has power over. That's the point I was making, and if there was any insinuation that from my comments that were not welcome, then I accept that. So, what in terms of recommendations, my view is we should have something in about IT, and we should have something about extra communication by using, as I say, the council's libraries, the council's publications like Hillingdon People, and also maybe even the social media that the council does so well. Or those three things, libraries, Hillingdon People, social media, need to get the message out there a bit more.
So where we are at the moment is we need to, at some stage, finalise these recommendations. So as a committee, how would we like to do that? I mean, I'm not keen on just looking at them myself and nodding them through. I don't think that's the way to go on with this. This committee works very well as a committee. Councillor Gardner.
Can I make a suggestion that we've all got lots of things going on that we'd like to do this and we'd like to do that. I mean, wouldn't it be easier if we just emailed each other and said, this is what our suggestions are, and we can pick holes in it, Tony, and, do the spelling mistakes and things like that, but work out, because we could come out with maybe 4 or 5 recommendations.
I think that's a sensible idea. The committee works well together. It has worked well together on this review, and we should have all have the opportunity to agree on the recommendations going forward. So what we will agree then is that we can all go away and have a little bit of a think about what that looks like. We've already got one from Councillor Cooper. There's a couple in here already. So what have we got? Have we got about a 2-week window to do that? Yeah. We've got a 2-week window in which we could do that. So if we could all focus our minds on that, and then hopefully we can all agree with it. I am concerned that it's quite difficult on email to agree. So it may be that Councillor Edgington and I will have to have some, and Councillor Flynn, we have some conversation. You're on holiday, did you say? Well, hopefully we can do it before then. But I think we're all mature enough to agree. This has been a very comprehensive review, and we need to do the best for our residents with this. So if we can do that in the next couple of weeks, that'd be really, really good.
Yeah.
Can we close this down and move on to the agenda item 8, which is the update? I excused officers from being here because some of us were on this committee when we did this report before, and I think it speaks for itself. It's a very, very comprehensive report. We can see quite clearly what's going on for our isolated and lonely residents. So we don't have an officer here. Is there anything anybody wants to say, or are we Councillor Gardner?
Maybe not. I'm just trying to think that people ought to bear in mind that I might be whatever I am now, but I was young at some point, and I don't... when my mother was... I'll tell you the story, right? When my mother was in a care home, they were sitting around singing, I don't know, Hang Out Your Washing on Siegfried Line, all this sort of stuff. And I was just wetting myself. I thought it was really, really funny. And the care staff was saying, why are you laughing? I said, well, look, my mum, God love her, was 94 when she died last year. But I said, when I'm sitting in one of these places, I don't want to be singing that sort of stuff. I'd like some Jefferson Airplane or Jimi Hendrix, or I'd like a weekend away at Glastonbury, you know, which would be kind of good. You wouldn't be socially isolated then, would you? No, I was just thinking, like, people should think ahead. Some of us old people were young ones and can still remember.
That's
remember
their comment,
things.
isn't it? That we continue to look at services in keeping with the age that we will be. Yeah, sure. Because I mean, I'm more of a Jackson 5 person myself than Jefferson Airplane. But there we go. Anybody else got any observations about that? No. Councillor Edgerton, did you have your hand in the air?
No, I didn't actually.
Oh.
But I will.
Ever so quickly then.
Oh, very, very. I mean, it's just that on page 87 there are a couple of occasions where it is hoped to consider this, which just sounds as though it might happen, but very unlikely. And that's the animal therapy session and also the spare chair system scheme. I don't think those are going to happen in my view, but on the basis of the comments made.
Well, we never know what's going to happen, do we? We don't know what's going to happen tomorrow. Okay, so we'll draw that one to a close. Forward plan is for noting. And...
yeah, could I ask?
I don't know. What are you going to ask?
Well, a very simple question. I see that the Safeguarding Adults Partnership Board annual report is going to the Cabinet meeting. Why isn't the local Safeguarding Children's Board report going?
I'm not sure why that is the case.
Or maybe it's treated as coming under the other pot.
I'm not sure. I don't...
Well, it was under the same item, wasn't it?
It's under the same item. I don't know why it's not. I'm sure we can find out why that is, but I don't have that answer off the top of my head, I'm afraid. Work programme is for noting. Unless there are any other comments or anything anybody wants to say, I'm going to draw the meeting. I'm going to draw the meeting to a close. Thank you all for your attendance, and see you all in, I think it's September, isn't it? 25th of September. Have a good month away from here. Good evening.